Well, thousands of New South Wales nurses and midwives walked off the job for the second time this year. They're demanding better pay rises and better nurse-to-patient ratios. They gathered outside State Parliament yesterday, expressing some of the difficult situations they've been in, including during the COVID pandemic. Joining me live now is the General Secretary of the New South Wales Nurses and Midwives Association, Brett Holmes. Brett, thanks so much for your time. First of all, has there been any movement on this from the state government?
No, I'm afraid I've heard nothing from the state government or the Ministry of Health in regard to responding to our members' very clear and loud claims for an improved health system delivered with nurse-to-patient ratios and midwifery ratios on every shift.
Right, okay, so those negotiations ongoing. I wanted to talk to you today as well because Labor did make an aged care announcement yesterday. What they want registered nurses in every home, aged care home, 24 hours a day. Is that feasible to happen? Do you have the nurses to do that?
It is feasible to happen if you make it happen, and that requires the full package that Labor announced last night. Improvement in wages is critically important. We need to make sure that those nurses who can be lured into the aged care system can be confident that they will have enough staff that they're supervising to be able to deliver the care that they're responsible for. There needs to be competitive wages and there needs to be accountability for those operators who are receiving Commonwealth money. So they're all important issues that Labor announced last night. We have been campaigning for registered nurse 24 hours a day, 7 days a week here in New South Wales for probably more than 8 years. Here in New South Wales, quite a number of the nursing homes that have been in operation for more than 10 years are required to have a registered nurse on duty, and there are other aged care facilities that have escaped that requirement. So we have this dichotomy of delivery of service here in New South Wales, but the same picture across Australia as well, in terms of there are operators who see the importance of registered nurses being on duty, and yet there are others who are trying to maximise their profits and avoid having registered nurses on duty. So this announcement is so welcome from the ALP last night. It has been a long campaign for the Australian Nursing Midwifery Federation and the New South Wales branch of the Federation, these nurses and midwives.
What's an RN paid compared to other staff?
Well, the differences vary because we're in an enterprise bargaining situation across aged care, but a registered nurse in aged care can expect around $70,000 a year. But the rates of pay do not always match those that are in the public sector. So if you're in a situation where there's competition, then the aged care sector has to be appropriately funded so that competition can be met and that we can get reassurance that it is both professionally safe to work in aged care. It certainly can be very rewarding work, but people also have to pay their bills. So we need to make sure that all of the aged care workers are properly paid. There is a very, relatively small number of registered nurses. That needs to increase if you want an increase in the quality of care and the access to qualified expertise that registered nurses provide. A lot of the work still is done by currently low-paid workers, and we need to increase their wages.
As we talk about this issue, we've been talking about it for years now, absolutely. We had to get the army in at one stage, but there wasn't a huge uptake in that, which tells us a little bit more about what's needed in terms of qualifications. But a lot of these aged care facilities, some of them are not-for-profit, but some of them are absolutely for-profit. What's happening in those homes? I mean, are those homes just going ahead and paying their people more?
Not necessarily. It's sometimes the not-for-profits that pay better rates of pay than the for-profits. Of course, you shouldn't assume that for-profits don't deliver some levels of good care versus the not-for-profits. So there are not-for-profits that we have a very low opinion of, but we want to see the whole system rise to the needs of the community. And some of the announcement last night from the ALP meets our expectations about accountability for this sector, for the money that the Commonwealth puts into it.
Sure.
There actually has to make sure.
Do you recognise as well that that is a top-up on a more than $17 billion commitment that the government already made in last year's budget?
Well, the government set up a Royal Commission to look into aged care, and it didn't go to the point of saying we're going to implement all of the recommendations of the Royal Commission that they set up themselves. They were only prepared to go to that $17 billion, and it really didn't fix the problems in aged care.
Yeah, it
still did not
Labor's not going to do that either, though, are they?
Well, their commitment goes much further to get to the Royal Commission's recommendation. The Royal Commission recommended 215 minutes. Look, the Royal Commission recommended 215 minutes. The Royal Commission recommended registered nurses 24/7. These are really important factors that will improve aged care. The Royal Commission recommended that wages be adjusted and that the Commonwealth Government make a positive submission to the Fair Work Commission in any case that was brought. The case is in front of the Fair Work Commission. And the federal government has simply said it's a hands-off approach. Labor last night said that they would positively tell the Fair Work Commission that they would fund.
Yes, they did, but Anthony Albanese was asked this morning as well, how much? What would that minimum wage be in aged care? He wouldn't say. Can you tell us what that should be?
Well, we support the claim for a 25% increase across the board.
Which would bring you up to the disability sector.
It would bring us closer to the disability sector. It should actually bring us up equal to the public health systems around the country as well. If you are going to compete, then you need to compete at the same level. So we need to see those increases. And of course, what Labor is doing is acknowledging that the Fair Work Commission has been set up to try and determine what the wages need to be, and will continue, along with the other unions involved, in putting forward our case for why those increases should occur. And, both governments, either party would have to fund what is given out of the Fair Work Commission. But it's important the message that governments give to the Fair Work Commission about the affordability and the commitment from government to help fund those wages, because there's no doubt that the employers will go in there and say, without assistance from the federal government, we can't pay this. And that's what we've been up against at the bargaining table for the last 15 years or so, that the employers have simply said, we can't give you better wages because the Commonwealth Government will not allow for that. So this announcement from Labor says that they understand their obligation that has been clearly set out by the Royal Commission to fund improved wages in aged care, and to commit to those standards of care that will help deliver a better outcome for our vulnerable elderly people of this country.
Brett, appreciate your time this morning.
Thank you.